survivor of esophageal cancer. I know I'm one of the lucky ones. I had the Ivor-Lewis method, which involves the abdomen and the chest. They did my surgery down the front. And there's the McKeon method, known as the one that involves the abdomen, the chest, as well as the neck. But there's been no proven evidence that says one is better than the other. So today's physicians usually do a laparoscopy for both methods. And when they do this surgery, they always deflate a lung. But in my particular instance, I had a lymph node that was outside the esophagus, slightly enlarged. And they thought if they did a needle biopsy, and if it were cancerous, it would spread it to my chest cavity. So they did a thoracotomy around my back right shoulder blade, went in and broke a rib and took out 18 or 19 lymph nodes, but they were all clear. I've had reflux since 1988, and when I was diagnosed with a stomach ulcer. I have been on a proton pump inhibitor ever since. And I know when you get them, it says on there, if you have to be on this longer than 2 or 3 weeks or 2 or 3 months, you need to see a physician. But I have been on them since 1988, and I'm still here. Though I thought I had the best doctor ever when I lived in Arkansas, but he only told me that I had the stomach ulcer when I was diagnosed. I was hurrying all the way through to my back with reflux, and so in 15 years they only did an EGD on me one time. Slightly mentioned I had Barrett's, and I didn't know what it was. But when we moved down here to Jacksonville, my husband was getting an executive checkup at Mayo, and I was bad-mouthing that they always check the men, but they don't the women. So he said, well, let's just get you checked too. Well, his test came back. He was clear, but I had cancer cells in my esophagus. But the doctor who really taught everybody, all the physicians, how to do this, retired the December that I was diagnosed. I think his name was Dr. Hinter. But anyway, the person who did mine usually did, he's retired now, but he did the lung and heart transplants. He studied under Christian Bernard in South Africa for 5 years. But he said this is one of the toughest surgeries that they do. When they took my esophagus and the top of my stomach and then pulled my stomach up to my neck. And the problem is they always have to watch for leaks because that is really, really tough to do. Well, I just wanted to see a survivor after I had my surgery. And it took 2 months before I found anyone who had lived through this. And since then, I've worked with over 420 esophageal cancer patients all across the country. I was asked to speak with a group in Mount Pleasant, South Carolina, not long ago. And this was a support group of all types of cancer, but one of them had been in our group. And I told them, this is not like just having your appendix out. When you have esophageal cancer or colon cancer, you have your digestive system that makes it difficult. We all have problems afterwards. We all have to learn how to eat. We have to do small meals. We have to eat nothing for 3 or 4 hours before we go to bed. I have to sleep sitting up. I cough if I bend over. I cough if I lie down. I cough if I eat thick food like steak or pork chops or even a hamburger. Spaghetti's okay, but it's very difficult. And usually I only eat 2 shrimp, and I cut each one into 6 pieces. We just went out for shrimp baskets this week with visiting company. And it's like, I laugh because I'm a cheap date, But we also have dumping, and that's when we either eat too much or we eat too rich food. We have diarrhea and throwing up at the same time. But I started advertising in the local newspapers saying, for esophageal cancer support, call or email me, and gave them my name and my email address. We met in a Mayo coffee shop. I've met in a sports bar. I've met at a diner at the beach, wherever we could. And we finally got a room at Mayo because we have one of the gastroenterologists and his nurse working with us. is how we're able to do this. Now we go to all the hospitals in the area, wherever we're needed. And they've all said, well, just come over, we have a room where you can meet. But our group has said, well, we've already started here, and it's easier to get in and out, and so this is why we do it. At Mayo, we have gone elsewhere too. We visited the University of Florida Proton Therapy Institute. We've also gone to the $15 million lab at Mayo. At the time they put it in, it was like 1 of 5 in the country, so now they're using it for a lot of teaching tools. We meet patients when they're in town for appointments, or when they have surgery. We meet them pre and post surgery, and we try to keep up with them by email or phone. And I try to put patients with like protocol together. Usually they're male patients in their 60s, but we see a lot of young people now, and I'm seeing more women. Well, esophageal cancer is the fastest growing cancer now. And it's also one of the deadliest. The mortality rate is so high. The highest is lung, and then pancreatic and esophageal almost tie for second place. The highest survival rates are for breast cancer, colon, and prostate cancers. Actually, esophageal cancer receives a very small portion of money from the American Cancer Society. A gastroenterologist on Amelia Island said this will soon be the #1 killer in the United States, partly because of obesity, but partly because people are buying over-the-counter meds. I was in Sam's and a guy picked up a big thing of Tums, put it on the counter, and I said, "Is that for you?" Excuse me. And he said, "Yes." And I said, "If you're buying Tums by this large a bottle, you really need to go to your doctor and have a gastroenterologist check you, because that's a sure sign." Over 17,000 a year are diagnosed of esophageal cancer. Over 15,000 a year die of esophageal cancer. The leading countries now are Japan, northern China, India, southern Africa, and Iran. A few years ago, the Mideast was, one of the highest, because these were the opium smoking countries. Protocol or treatment depends on a few things. One's the age of the patient, the stage and the size of the tumor, and prior surgeries, as well as the patient's ability to undergo a major operation. The usual types of cancer cells associated with esophageal cancer are squamous cell carcinoma, usually found in the middle or the upper esophagus, often found in African Americans, and adenocarcinoma, usually found in the lower part or at the junction of the stomach. That's where most of them are found for Caucasians. And they also remove the sphincter muscle. The only good thing about all this is, when they do our surgery, they cut that vagus nerve, and we never have an appetite. The alternatives to esophageal cancer are the Ivor-Lewis or minimum invasive surgeries, radiofrequency, chemotherapy and radiation or photodynamic therapy, proton therapy, and now they have targeted drugs that are being tested and found to be effective, as well as laser therapy. Our support group puts out rack cards and does booths at various places, registrations for cancer runs for corporations who request it, and sometimes the doctors have asked us to meet with them when they're doing a presentation. We set up a booth. We emphasize that the majority of EC is caused by reflux, but it's better to sleep on your left side because stomach acids can't flow into your stomach because it comes out of the right side of your stomach, and this helps digestion and prevents acid reflux. And when we were at the lab, this $15 million lab on top of the Esophageal Center, we wanted to see the esophagus. They have this case that looks like 5 feet by 2 feet wide, and inside is just like a body made up of wires and so forth, and you press a button and things will light up. And we wanted to see the esophagus. Well, the thing was lying on its right side, and we couldn't see the esophagus. So they just moved their hand, and the thing turned over, and there was the esophagus lying right there. But it also improves lymph drainage of waste material for you to lie on your left side. Easier for your heart to pump blood through your body because your main artery bends to the left. Your stomach and pancreas are located on the left side, and when we lie on our right side, the stomach pushes the pancreas and obstructs its functioning. And waste materials are transported to the spleen on the left side of the body, and they can be expelled from the body faster. We leave our business cards and our rack cards with doctors, nurses, social workers. And because of confidentiality, they can't give us patients' names, but they can give our information to the patients. Or if the patient tells them, sometimes they'll say, ask us to contact them, so they do. But we work real well together. We also provide a bibliography of books that we have read that would help others. We've gone down to Titusville, Florida to have lunch with those near there so they can meet the others in their area, because we have quite a few on that area down there on the eastern part of Florida. We have a satellite group started in Branson, Missouri that's up and running and has become a nonprofit as well. We meet and work with those in the Branson and Atlanta, Georgia area. And ECAN has been a great help to our group in providing brochures, flyers, posters, arm bracelets, and we have our own now. I've always said somebody else could put, I'm willing to put somebody else's telephone number on there if they'd like. But anyway, the ECAN's been good in getting suggestions out for getting legislatures to promote April as Esophageal Cancer Awareness Month, which we do now have in Florida. Early detection is critical. That's why ECAN's work, as well as our support group, ECSI, are so important. How many times we hear people tell us that somebody in their family died of EC, or how their spouse has reflux so badly and won't go to the doctor. We even hear, I went to the doctor because I thought I was having a heart attack, and the doctor just laughed and said, you're not having a heart attack, that's just reflux, and sent me home. And we said, of course, you need to go to your primary doctor and say, I need an appointment with a gastroenterologist for an EGD, because that is really a sure sign. Reflux is not the only thing to worry about. There's a silent killer, the esophageal cancer that one doesn't have a symptom of until one can't swallow or one has an obvious blockage in their esophagus. By that time, it's usually stage 3 or 4, often inoperable. So please help us by joining in the fight to save lives. Wear your periwinkle blue. Thank you very much.